this video and has an upcoming book soon to be released about the mind-body connection. So if you have a round of applause for Shara.
Okay, well, thank you so much. Thank you for having me. This talk is going to be about as 360 as the last few talks, because this is a talk where you actually get to shut down your frontal cortex, and you get to go into your feeling body for my talk. Okay, and I'd like you to go ahead and write your name at the top of the piece of paper, and then write the date next to it. Today's the 16th. And as you're writing, I want you to pay attention to how tightly are you holding the pen. Are your fingers blanching as you're holding the pen? Go ahead and write it again, or maybe 2-3 times. And I want you to pay attention to, is there any tension in your jaw as you're writing your name or writing whatever you want right now? And how about your shoulder? How much tension is in your shoulder? And does your breathing halt, or does your breathing stay as continuous as it was prior to writing your name? Just kind of make some observations around that, because I'm going to talk for about 10 minutes about how stress and the somatic response comes into our body. And then we're going to do a Feldenkrais lesson. And then at the very end, you could have the opportunity to write your name again and see if you've noticed a little bit of shift. So a lot of I've worked with ergonomics for quite a period of time. And actually, the extensor posture is something I see with most hand clients, and pretty much all overused hand clients have lost the natural C shape of the fingers when they type. So I always tell people when I'm doing like ergonomic consults or treating them in the clinic that the way to refine your neutral postures of your hand is just to simply stand up and let your hand fall into the 3 joints, or simply bent like this in the C shape. And then you take this posture up to the keyboard, and you try to maintain this posture. And the only time you actually extend your fingers to lift it up to touch the other keys is when you actually are going to a different key. So overuse injuries are caused by we're overcontracting our muscles unnecessarily. So very often we'll see, I call this the Buckingham Palace syndrome. So we'll be typing with this hand, and you'll see this hand doing this. Or we'll be mousing, and all the fingers will be hyperextended off of this. So this is a really tough thing to retrain in a person, but the first thing is education. That's most important. So true healing, in my Feldenkrais brain perspective, of such diagnosis really occurs, and this is more for chronic conditions, when we re-regulate the balance of the flexors and the extensors. We learn to engage more of the proximal musculature, and at the proper time. So that means, I know a lot of people like do Pilates and they think, okay, we got to hold in here, we got to tense in here, but no, we actually want to breathe to our fullest. We actually want to have the most parts of ourselves available for breathing for any tasks that's possible, whether it's running because we're running late, or whether it's sitting doing our work. What happens with people once they have chronic pain is they start to inhibit all the breathing in their chest. So a lot of my focus when I work with people like fibromyalgia and chronic pain is I really look at the movement of the chest and how the scapula is moving on the chest wall, how the pelvis is integrated, and mostly it's locked. Locked like they have a straitjacket on, and they're walking through life with a straitjacket on. And they don't know it. And that's the crazy thing. They don't know. Their body awareness gets dimmed the more and more they get into this pain cycle, because they get so overwhelmed with the doctor's appointments and the pain, and their narrow vision starts to go. So I might do a little bit of a Feldenkrais lesson, like maybe I'll do a jaw and teeth lesson, and all of a sudden their peripheral vision opens, their arms and their shoulders open as well, their shoulder blades slide into a protracted instead of a retracted, or opposite, and their pelvis actually starts to open up, and breathing starts. And then they get up and they're like, my pain has gone out, and I don't understand how this worked from just working on my jaw. Sometimes I can't explain it either, but I find it pretty miraculous a lot of the times. And the third part is to treat, in my perspective. This is solely nothing I've read. This is just my beliefs after working for the last 20 years with chronic pain, hand injuries, those kind of diagnoses, is learning to allow the muscles that you're not using to relax. So most people don't know the difference between a contracted and a relaxed muscle. They have, in fact, no idea. And it takes them, it's somewhat correlated to the amount of their pain state, to the longevity, and to the amount that they're in their situation, that they'll have no idea. And when I work with them, they start to feel their bodies, and it's a whole new getting to know yourself experience. So we're going to go ahead and move to a Feldenkrais lesson right now. I think that's all my slides. Although, yeah, okay. So for this Feldenkrais lesson, if you could go ahead and scoot forward in your chair and sit in uncross your legs. So sit forward so that your back of your chair is not touching the back of, your back is not touching the back of the chair. Okay. And actually, let's just start to get curious about where we chose to put our legs and our feet. Let's try to bring your legs a little bit closer towards one another, because you know how often people sit in the office like this, right? And just notice what happens to your breathing as you're sitting like this. Yeah. What happens to your vision? Does it get more narrow? And what happens to your shoulder complex? Does it become more internally rotated and compressed? Okay, so when I talk about the flexor pattern, this is what I'm talking about. Okay, and then let's go ahead and find a place that feels comfortable. And I always think about good posture is the posture that you're breathing the best in. So maybe if you want to try like an inch closer, further apart, play around and find the posture that you're breathing is the fullest. So let's go ahead, scoot forward on your chair once again. Find that comfortable place for your feet, ankles, and knees. And let's go ahead and do the same motion, but this time I want you to instigate it from your back. So very gently roll your back slightly back towards the back of your chair and let your head fall slightly forward. And then you could think about your lumbar spine going slightly forward and your head being carried up. So go back and forth. Now I want you to see if you could do less muscle effort, but at the same time maybe even going a little bit further. As you come back up, meaning you're sitting on your two sit bones, the heads of your two sit bones, feel your vertebrae stack one on top of the other. So one of my favorite things to talk about is sitting, actually, and how to find a good sitting posture. So you'll notice that the cervical spine and the lumbar spine are somewhat inverse relationships. So the more that the low back, the lumbar spine comes forward, the more the cervical will go back. What a great way to help somebody who's got that forward head movement. I mean, they just, when they work so much, you know, with their back rounded and head forward posture. So go a little bit further. And one more time, make sure your breathing is really free. Make sure you're refraining from halting your breath with any of these motions. Okay, stop and take a rest. Go back in your chair. So a good way to know if a new pattern is learned or a new movement is learned is that your breathing will be fluid. So oftentimes when we're learning a new task or skill, we halt our breath and we contract muscles like around our viscera and around our pelvis. And it's not necessary. Okay, so go ahead and scoot forward onto your chair. Find that comfortable posture. And you might notice that now it's a little bit more comfortable sitting in this posture without back support. So we're going to do a one-sided lesson. So I'm going to suggest you do your right side or whatever hand you wrote with, whatever your dominant hand is. Let's just focus on that side, okay? So let's start by having your pinky resting on your thigh. And I'd like you to start with a very gentle supination, but do it in a way where you're just moving a few degrees with your palm up towards the ceiling, and then bringing it back to neutral. So in other words, you're just rolling on your pinky finger, rolling your palm up and going very slow, and then back to the start. If you want to just do 3 or 4 movements and then take a break and then continue again, that's perfectly fine. Go at your own pace. As you turn your palm up towards supination, notice what happens with your AC joint. What happens with that space around your clavicle. And if you want to go a few degrees further into supination, because your body's very wise, your bodies actually learn really fast when we set the right environment for it to learn. So if you're limited in supination in any way, shape, or form, by now you would probably have a few degrees more of supination. And as you continue this exploration, feel what's happening in your scapula. How does your scapula move? It's amazing. Okay, just take a break. You could rest back in your chair. It's amazing. We think about like hand motions as like so distally, but there's so much movement going on proximally.